right. We're going to do wound care today. And we're going to start by saying I'll cut a little bit, cut a little bit, cut a little bit, cut a little bit, stop. All right, today we're going to be doing wound care, just so you can see my face. I'm going to try to do as close up as I can. And first we're going to start by performing hand hygiene. And then we're going to put on personal equipment, personal protective equipment. If you have a patient, sometimes you may need to do a sterile change for the sake of being at home and using a cute purple unicorn. We are going to do a dry dressing. And at this time you would explain to your patient that you're going to be doing a dressing change, a dry dressing change, and assessing the wounds and making sure at the end of everything that you document everything. So after putting on your PPE and explain to your patient that you're going to change their wound, their dressing on their wound, you're going to remove the patient's covers, blankets, sheets, and then you're going to apply an absorbent pad underneath where the wound is, and we're just going to pretend that this is my patient's leg and it's not so wobbly. And just so that way if there's any drainage, it will leak out onto the absorbent pad. And then you would measure your patient's wound, and let's just say for the sake of this, we're just going to say that this is about 12 centimeters. So after you've measured your patient's wound, we're going to remove and discard the dressing. And if the dressing is too dry, you would want to use saline solution to wet it to help help remove it. So you're gonna start by gently rolling it up. And after that, we're going to discard this, and we're going to discard, and if it is then we're going to assess the wound to see if there's any drainage, how the wound is actually healing up in the process. And then we would cleanse the wound with an antiseptic swab, and I'm not going to open it, but for one swab you would take and you would clean down the middle, and then you would dispose of that one, then you would clean on the side, dispose of that one. There's 3 in the pack. And then you're going to cleanse the other side and dispose of that one. And then after that, we're going to apply our appropriate dressing wound, and just make sure that you gently apply this to your patient. And then after that, you're going to document everything that what you've done and how the wound is healing and everything like that. But before documenting, you want to discard of the absorbent pad along with your gloves. And then document.